This segment of DelmarvaLife is sponsored by TidalHealth.
Topics concerning health can sometimes be sensitive, even embarrassing. It's all depending on the details. This embarrassment can often be to our own detriment, especially if it leads us into a situation where we aren't asking medical professions questions or concerns that we may be having.
Yeah, so how can we break down those barriers, and how can we discuss some of the topics that make us a little squeamish or a little uneasy? Well, guess what? Here to answer that question is Chris Snyder. Dr. Chris Snyder, forgive me. He is also known as Dr. Taboo. Thank you for Okay, so remind us, this has to do with the podcast.
It does, yeah. Get Well Delmarva. Yeah, we try to publish something every week, just questions, awkward ones. And
you're Dr. Taboo?
I am, so hopefully we can answer some. Some of them I have no idea, but that's okay.
Oh, okay, all right.
There's a lot of things about the human body. It's very interesting. So.
Yeah, and some of us, kind of scared, kind of queasy, kind of embarrassed. One of the questions, though, that we want to talk about, ingrown toenails and toe fungus. Not something that, you spike up a conversation about.
No, but pretty common, so it's something we see every day. Redness around especially the big toe, that's usually where it is. And it's usually from hygiene, nail hygiene. So most time cutting it too short, and actually the nail gets embedded underneath the little skin layer around the edge called your perinechium, and that can get infected. Infection can be from a fungus. That's one of the things. It's called tinea pedis. And that can occur usually between the toes and go into the nails. And then you can get a bacterial infection after that too, and that can get pretty nasty. Sometimes we have to put you on antibiotics, but podiatrists are your doctors of choice. Family doctors can also manage a lot of this, so depending on their experience with toes. So kind of a weird thing.
Okay.
No.
So I always hear terms like discharge and I can't remember what the other one was. I'm just going to ask you in plain language, what does the color of snot tell you?
And there's really three major ones, well, four if you count blood, but we're not going to count blood. So
okay.
Clear, which is usually called rhinorrhea, that's got a big word with it. So it's just basically liquid coming out of the nose, usually with allergies, stuff like that. And then usually the yellows and the greens are getting either drier or possibly bacterial or viral, either way. So infection causes the color change. You get thickening of the mucus, and that causes the color. So if you leave it out, if you leave snot out, it's going to change color, whether you're in your nose or not. But the sinuses are there to humidify the air, so when they get congested, things kind of sit and they get green and yellow and nasty, and sometimes we have to treat you with meds. But.
Gotcha.
All right, well, let's stay on the subject of discharge, a different kind. Let's talk poop, okay? I think everybody's experienced.
Or lack of.
Lack of, there you go. I mean, what happened? I mean, can you go a week without pooping? And
everybody's got their own regimen. A lot of it's nutritional based, so it depends on what you eat. There are some pharmaceuticals that actually cause that to be a problem in geriatrics. So age group plays a lot of role, symptoms play a lot of role. Usually if you get symptomatic with abdominal pain or discomfort, you need a cathartic or something to make things roll. And you can use things naturally, raisins, prunes, all that stuff is really good. Number one, actually cathartic is water, believe it or not. So your colon actually absorbs the water from the stool. So if you don't have enough water in there, it'll dry it out too much, it'll tend to not move. So you can get obstructions with that. If you had surgery also, that can cause obstructions. So there are some surgical potentials with this, especially as you get older and you've had multiple surgeries that can create adhesions or scar tissue that closes up the bowel and causes the stool to not move through. So it's complicated. See your doc. If you get uncomfortable, how long's too long? If you're not uncomfortable, usually it's not too long. And if you're only eating a pea-sized meal every day, you're not going to go. So what goes in must come out eventually. So it's got a fairly long transit time. So hydration's number one, and then any kind of natural cathartics. And usually 3 to 5 days. If you're uncomfortable, you should probably go see somebody if that's recurrent week after week.
We told you that some of these questions are going to be something you might be embarrassed to ask. So what do we need to know about nipple discharge?
Well, that's a tough one. So in a guy, that's really abnormal, but it can happen. In women, it's normal, especially if you had a baby. Some women lactate, we call it, after getting pregnant. It's appropriate. All through pregnancy, they'll do that, and obviously they feed the baby with that. So that's pretty normal. One-sided discharge out of a nipple is usually abnormal, and you have to worry about glandular problems. The breast is very glandular. You can get tumors in it, breast cancer. You can get skin cancers in it. There's all sorts of different diseases diseases that cause it. Anything bloody out of the breast really needs one of us to talk about it. So if you're not pregnant, or if you're a man and you have nipple discharge, probably a good idea to get somebody to palpate to make sure we're not dealing with something bad.
Check it out.
Yeah. Let's circle back to the podcast. How can folks hear it?
So they go on to Get Well Delmarva, type in podcast, or you can put Taboo in there if you want, and you'll find it. So we've been doing it for, I think, a year now. My goodness, I can't remember. But and again, we ask local providers questions also, what they've been asked. So we'll go to some of our local docs and say, hey, what's weird things? Because I can't think of everything. So and then we also have some other folks, some of the editors who get in there, and we'll bring up some ideas. But if you have ideas, just shoot us a message on there. We'll try to answer it. We talk about a lot of things, everything from depression, suicide, to nipple discharge.
Wow.
So.
All right. Well, Dr. Taboo, Dr. Chris Snyder, a.k.a. Dr. Taboo, thank you so much for coming in today.